Thank you for taking the time today to listen to an update on the PIUO study, a study looking to help children with unexplained pain and irritability. Dr. Hal Seiden and Dr. Tim Oberlander are the co-PIs on this study. They have both worked for many years with our target population and have led the team from the initiation of Childbright and the PIUO study in 2016-2017. Our participants are children under 18 who have severe neurological impairment, also known as SNI, are nonverbal and non-mobile. Pain is the most common symptom reported by parents of children with SNI, but these children cannot tell their caregivers where it hurts. Caregivers rely on interpretation of nonspecific pain-like behaviors to detect the presence of pain. We also know that children with complex neurological conditions, pain-like behaviors are not always due to disease or injury, but may be due to generalized irritability of the central nervous system. Due to these complexities, often our participants have received inconsistent, ineffective care that have left their families struggling with the frustration of ongoing pain and irritability. We believe that lack of a standardized approach to investigating and managing PIUO is contributing to pain, persistence, and suffering in our target population. To address this, our team developed a systematic approach, the PIUO pathway. It incorporates structured history-taking, physical examination, screening investigations for unknown sources of pain, and pharmacological interventions. The goal is to efficiently assess treatable causes of nociceptive inflammatory pain. What is novel about this approach is the systematic manner in which these screens are done. To our participants, it makes a real difference that they have frequent contact with one RN and the MD to turn every stone. At every step, we ask if their pain is identified. If it is, we treat, and if it is not, then we move forward with the next step. We have 4 sites across Canada. We have not been able to meet our original recruitment goal of 120 participants, partly due to the pandemic and partly for reasons we are investigating further. For instance, whether the establishment of complex care clinics across children's hospitals mean that our target population is receiving the kind of focused attention and care that was not available to them some years ago. We are getting ready to analyze the vast amounts of data we have collected in collaboration with Childbright entities. We have received lots of positive feedback from study participants about their experience of being part of the PIUO study. We are now supporting a number of spin-off projects and looking towards phase 2. Our goal is to gain a better understanding of how parents to children with medical complexity experience being part of research and the impacts of research in their day-to-day lives. Thank you for listening.
Hello, everyone. Thank you for attending this update for Childbright Project 2.2, Strongest Families Neurodevelopmental. Our project is focused on developing mental health supports for children and families. My name is Patrick McGrath. I'm speaking to you from Ottawa, the traditional unceded territory of the Algonquin Anishinaabe people. My research lab is located in Halifax, the traditional lands of the Mi'kmaq, and my co-investigator, Lucina Locke, is from McGill University, which sits on the lands of the Gahaga people. Our parent advisors and study participants span the breadth of the country, encompassing many more traditional Indigenous lands. Our research team includes lead investigators, parent advisors, research trainees, and administrative staff. Each person on our team is essential to the success of our work, so I'd like to begin by saying thank you very much to all of you. As part of the Childbright Network, we've conducted studies exploring a variety of topics, including use of online support groups, parent training for challenging behaviors, post-traumatic stress and post-traumatic growth, and access to mental health care. We are very proud of the knowledge that has been generated by our team. 3 major accomplishments for this project are the development of the Parenting Trauma Checklist to assess PTSD symptoms in parents, and the completion of 2 randomized trials testing programs we developed to support parents. The Strongest Families Neurodevelopmental program is designed to help parents with children's challenging behaviors, such as regulating emotions, transitioning to new or unexpected situations. The Life Beyond Trauma Narrative Exposure Therapy program helps parents address their own trauma and PTSD, which can stem from experiences related to their children's health and well-being or from their other life experiences. Both programs have been co-designed with parents and are conducted online with the help of paraprofessional coaches. Our trauma work is a direct result of collaboration with our parent advisors and is especially innovative as it is the first time this type of intervention has been delivered virtually using paraprofessional coaches. We are pleased to have 3 posters being presented today. In addition to a poster summarizing our project achievement, Sydney Walker is presenting on a systematic review looking at factors that are related to depression, anxiety, and PTSD in parents of children with disabilities. I will be presenting the preliminary results of the narrative exposure therapy, or ENET. The main outcome data for the Strongest Families parenting program is currently being analyzed, and we hope to have results ready to share early in 2023. However, our colleague, Arnie at Sick Kids will be presenting early data from an economic analysis of the Strongest Families parenting program. We've already started planning for phase 2 of the Child Right Initiative, which will involve making the Strongest Families programs available to families across Canada and expanding evidence for the NET PTSD program. We're also in the early stages of designing a study looking at how interventions like ours make it into practice. As we reflect on our accomplishments, we know that there's much work to be done. While our programs are designed to break down barriers of accessing care by tapping into virtual care and using paraprofessional coaches rather than more costly practitioners, barriers to care remain. We must be innovative in expanding access to marginalized families through a lens of diversity, equity, and accessibility. And with the help of our parent advisors and other stakeholders, we will continue to push for change and promote sustainable access to evidence-based mental health care for all families. Thank you very much.
Hello, everyone. It's a pleasure to be here to talk to you about the Joaay project. Joaay, as you hopefully know, is a mobile app that has been created by myself and Dr. Annette Mainemer to help children and their families find activities that are suitable for their needs. We have an amazing team of co-investigators, family partners, clinician partners, community, and youth. And that's our team of jurors who have been advising on the creation in every step of this research project. Joaay started with a need identified by families of not knowing where to go to find adapted and inclusive leisure activities for their children, activities such as sports, camps, and arts that were suitable according to the needs of their child with different disabilities. As you can see here, we've been going through a lot of different research phases. We have had app development, what you see here in blue, from 2012 up to now. So from the creation of 2 different versions, the expansion from 5 provinces to all provinces in the Yukon territory, and now we are going to work towards the addition of gamification features and other features into the app. We also have done some population health studies related to the app, such as community inclusion, developing an index to help cities and municipalities and other programs to be adapted and inclusive. And we have also created, during the pandemic, we've studied how to create online inclusive leisure activities that meet the needs of children with different disabilities. We have also done some implementation and knowledge mobilization studies, including starting back in 2015 with projects funded by Implemented Social Development Canada, where we created networks of champions or knowledge brokers. And also we have expanded the research team to include multiple interest parties and community partners and organizations. And we also have analyzed the app usage, so how families access information during the pandemic and how we can improve that through providing better access to this information. And now on the second phase, we're going to expand the understanding of implementation science through the use of knowledge brokers networks. And we will include sites that before as sites where activities are usually not available or where children do not have access to community programs. Improve and understand better how mobile gamification, so playful features within the app, can support the participation activities in the community for youth. And we will implement in the future. We'll scale up. You can't see because my image is right on top of it, but what we'll see is how these mobile apps can be used to support health outcomes for different populations, such as children with families. Some new aspects that phase one, we have now a total of over 4,000 users and almost 3,000 activities, plus almost 500 activities online worldwide, and that across all provinces of Canada and in Australia. We also have a growing steady growth into our social media channels and helps creating community around leisure and disseminating information. And we have also produced a series of research papers in different areas such as childhood disability, population health, and mobile health in different journals. Some considerations for phase two that we would like to highlight. So we are working hard to improve our equity, diversity, and inclusion aspects, including underrepresented groups and regions of Canada. We will try to expand our knowledge broker networks to represent regions that have higher social and material deprivation and engage with the Indigenous communities to learn how technology and other aspects of community inclusion can be understood or better understood in these regions. We are working towards implementation and knowledge mobilization strategies, and we'll be studying them up close. Look into effectiveness implementation hybrid design in this phase two study to test implementation strategies, particularly the knowledge brokers networks. We use an interrupted time series design, and we'll have different KM strategies, including constructive dialogues with interest parties, social media strategies, and in-app notifications and events. We have for that a list of collaborators that you can see here on the side, and we are always growing our collaborators through NGOs, community partners, clinical sites, and also government and municipalities. We have a lot of funding to develop the app up to this point, and also extreme excellent partnerships, and we'll be happy to have any conversations about the project past and the future. Thank you.
Hi, I'm Jennifer Crosby, Principal Investigator of Megateam Project 2.5 of Child Bright. Megateam is a video game-based cognitive rehabilitation program targeting executive functions and emotional regulation in brain-based disorders. We're really happy to say that recruitment has closed. We're finalizing those last visits, and we're really excited to start analyses coming up in February 2023. Final sample size was 168 ADHD children and 58 children with ASD. Youth co-design and family involvement has been a cornerstone of the Megateam project. We're really excited to report that we've had great involvement right across the core elements. We're looking forward to youth and parent involvement in analyses and interpretation in February 2023, and of course, Child Bright 2.0, where we focus on implementation and dissemination. We asked some of our youth advisors to share their perspectives on why youth advisors are critical.
Personally, why I think having youth advisors on a team for a project like this is super important, because I notice often with projects like this, there's a certain level of disconnect between the developers and the people it's intended for. So I think having youth advisors are extremely important, because it helps connect that, right? Because you have somebody who not only has ADHD, but also, plays games like these and knows and has the perspective of, maybe a bit older, but.
All right, and Austin.
Because other people my age, like say for like group 14-year-olds together, we kind of would all have a general idea of like our perspective of video games. So with youth, it will be a lot easier to know what other kids will actually be interested in. Because if you put a bunch of adults and a bunch of 14-year-olds together, if you just let the adults handle it, they're going to have a very, very different perspective than the youth. Because
all right, moving on to collaboration, training, and knowledge translation. Here we have Dr. Teddy Chung, who's a new postdoc in our lab, along with Wendy Unger. We're really excited to be working with Wendy and her health economic group, along with Roa Chakri, who is going to be looking specifically at Megateam with regards to health economics. We've had fantastic co-ops through the summer student program, but right through the year as well, represented here from a range of different university programs. We've really just been lucky to have fantastic future researchers as part of our team, both from a staff and from a trainee perspective. Finally, with regards to knowledge translation, myself and Dr. Bedard, one of the co-investigators, has had an opportunity to really present the importance of youth co-design, why it's necessary for these kinds of novel developments. This is us at a conference in the fall. And most importantly, we're really looking forward to Child Bright 2.0 with a focus on implementation and dissemination. Thank you, Child Bright.